Hello, how are you doing? Good, good. I understand you're here today for a hand examination. All right, we can definitely do that. So, there are a few parts to the hand exam. I'm going to be looking at your hands. I will do some touching to check for issues. We'll have you do some movements and then some movements against resistance. Would that be all right with you? Okay, great. Let's get started. First, we'll just reposition so I can get a good look at your hands. All right? Let's do it. Okay, are you comfortable? Great. So to begin, I'm just going to be looking at your hands just to note if there are any issues. Look top and bottom. Looks okay. Go ahead and flip your hand over. On the side. Okay. And go ahead and put your hands on your shoulders and point your elbows up towards me at 90 degrees there. Perfect. Then just go ahead and bring your hands down. And I'm just going to be feeling your arms and fingers. Just make sure we don't feel anything here. And the other side. Looks good. The same on this side. And do the other side. Okay, and I'm just going to feel the temperature on your hands here. Now go ahead and I'm going to take your hand and we'll just relax and let me move it. Just going to move that up and down and feel that joint. Have a look at the side of your hand here. Things looking good. And again, just nice and relaxed. Allow me to move your hand. And we'll feel that joint. Get the side of your hand here. And rotate on the side. I'm just going to squeeze your fingers here. Okay, good. Now what I'm going to be doing is just feel all of the small joints in your hands. Just going to press, 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 press. Just feel each of those knuckles. Press, press, press. Thumb. Good, perfect. And on this hand, just check out each of these joints, make sure we don't have any issues. Press, 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 and finishing with the thumb. Last press there. Okay, good. No issues there. And I'm just going to lightly squeeze your hands. Okay, good. So now we're going to do a few simple movements. First, go ahead and turn your hands over. And I'll just, starting with this hand here, have you roll that up, make a fist. Go ahead and roll those fingers all the way. And relax. And same on this side, roll your fingers up. Good. And relax. Now let's turn the hands over. And then go ahead and lift them up. And let's have you spread those fingers out as wide as you can. Okay, good. You can relax. Now, I'm going to take your hand. Just let me do the movement. I'm just going to roll those fingers up. Good. I'll do the same on this side. Just allow me to do it. Good. Now, have your palms out, palms down, your arms out. And I'm just going to press your fingers upward. Just, you can relax. And we'll do the same on this side. Okay, good. Now, what I'd like you to do is we'll start on this side. Bring your hand, bring your palm up, and just try to rotate. Bring those fingers back to you as much as you can. Good. And there's no pain or discomfort with that, is there? Okay. Now, what I'm going to do is I'm just going to add just a little bit of pressure onto that movement. And no pain or discomfort with that. Okay, good. Let's do the same on this hand. Have you face your palm towards you. And head back. And keep those fingers straight. Good. And now I'm going to apply just a bit of pressure there as well. And no pain on that side, right? Okay, good. Now let's go ahead and do a similar exercise, but going to turn your palm out this time. Same thing, just bend those fingers back. Good. And I'm also again going to apply just a bit of pressure. Is that okay? No pain with that? Okay. And same on this side. And that. Okay, good. And now I'm just going to apply a little bit of pressure. Good. No pain on that side either. Great. Very good. Now, go ahead and turn your hands over. And I'm going to be holding some of your fingers and having you move the fingers that I asked so we can see some of these more specific movements within your fingers, okay? So to start with, I'm going to hold your fingers down, and I just want you to lift the tip of your middle finger. Good. Now, same thing, but lift your whole finger. And curl that up as much as you can. Perfect. We'll do the same on this hand. Go ahead and lift just the tip of your middle finger. Good. And now lift that whole finger. Good. And go ahead and curl it towards your palm. Perfect. Now, I'm going to take the thumb, and I will hold your thumb and just bend the tip of your thumb. Good. And on this side, bend the tip of the thumb. Perfect. Now, I'm going to have you make an OK sign, like that. Perfect. And I'm going to pull, and don't let me pull your fingers apart. Good. Now, go ahead and turn your hands over. Let's spread your fingers out like this, and don't let me close those fingers. Same on this hand, I'm going to push them together and don't let me close them. Good. And now I want you to go ahead and grab my fingers, and what I want you to do is squeeze them. Give it a nice hard squeeze. There you go, just like you're going to crush them. Perfect. Very good. Now, let's turn those hands back over. And can you bring your thumb to your pinky for me? And on this hand as well. Good. Now, how about to the base of your pinky finger? Good. And can you move that, the base, across your hand? Just like that. Perfect. And now please touch your thumb to each of your fingers in turn. Good. And on this hand as well. Excellent. So now what we're going to do is have you do some movements, but this time with a little bit of pressure. So I'm just going to have you put your hands out, palms down, and don't let me push your fingers down. Good. And same on this hand. Don't let me push your fingers down. Perfect. Very good. So now, next, place your hands out like this, thumbs pointed toward the ceiling, and don't allow me to push your thumbs down. Perfect. And now go ahead and push my thumbs down. Good. You have strong thumbs. Do you do a lot of hitchhiking? I see. And now I'm going to have you place your palms face up and then point those thumbs toward the ceiling. And same idea, I'm going to try to push down your thumbs. Don't let me. Good. And now you push down my thumbs. Good. Now, what I'm going to have you do is start with your left hand and go ahead and have your palm facing toward yourself. Bring your wrist up just like that. And what I'm going to do is I'm going to pull against your hand, and don't let me pull it down. I'm going to pull, pull, pull. Excellent. Now go ahead and rotate your hand around so your palm faces me. Exactly the same thing. I'm going to be pulling on your hand, and don't let me pull it down. Pulling, pulling, and pulling. Good. And let's do this hand. That hand can relax. So bring this hand up, palm towards yourself, and I will pull, and don't let me pull it down. Good. Pulling. Good. And now turn your palm outward. Same drill. I will pull, and don't let me pull it down. Pulling, pulling, pulling. Good. Now let's go ahead and relax for a moment. And now, this time, I'm going to apply pressure to the side of your hand. Keeping your forearms straight, just go ahead and rotate that wrist to push your pinky outward. Okay, so go ahead and push out, push out, push out. Good. And same thing, but this time we'll be rotating your thumb inwards like this. So go ahead and press against me, rotate that inwards. Good. Relax. And same on this side. Let's take your pinky and we'll push outward. Rotate that wrist. Some pressure. Perfect. And same, we'll take the thumbs, pushing inward. Good. Pressing. Good. Perfect. It's all looking very good. Now, what I'm going to have you do is bring this hand up, and we'll fold your thumb into your palm. Go ahead and wrap your fingers around that like this. And I'm going to take your hand and allow me to move it. And I'm just going to bend that wrist down. You can relax it. Just going to bend it downward. Just like that. And are there any issues along the top of your wrist, the inside, any pain, any discomfort? Good. You can relax. And I'm going to take your hand, and I'm just going to apply a little bit of pressure here against your wrist. And there's no pain or any issues when I do that, right? Okay, good. Relax that hand. Same on this side. Let's have your hand up. Bring the thumb down, wrap the fingers around. Good. And you can relax. I'm just going to pull it down. And any discomfort in the wrist when I do that. Good. Go ahead and relax your hand. Same thing. We'll apply some pressure. And no pain. No issue there, right? Good, good. All right. So now what I'm going to be doing is making sure that the small bone here at the base of the thumb is in the correct position. So I'm just going to have you lift your hand up to me like this, so I can just use my thumb to feel for that bone. And I'm just going to move your hand a little bit, just to make sure everything's moving smoothly in there. There's nothing out of place. Good, feels good. Let me look at this side as well. And I'm just gonna find that bone with my thumb and apply a little pressure there. And there's no discomfort, right? Excellent. Just gonna move that hand around a bit. Perfect. And there's no pain on that side, right? Okay, good. Now, next, I'm going to apply a little pressure in the direction of your arm. We're going to be checking the meniscus in your wrist. This one can feel a little bit uncomfortable, so just let me know if you feel anything. So I'll take this and I'll just apply some pressure to your wrist. And then I'm just going to move it around, just kind of like a wave, kind of like a handshake, just rotating things every which way. Perfect, and no discomfort there, right? Let's do the same on this hand. Great. Just going to apply a little bit of pressure, then move that hand. Great. And no pain on this side, is there? Okay, good. All right, everything is looking very good so far. We are almost done here. What I'm going to have you do is we're going to take this piece of paper and I'm going to have you hold it between your thumbs like this. Go ahead and grab. And I'm going to try to pull the paper away from you and you just hold on to it, okay? Here we go. You're going to pull and pull. Perfect. Excellent. You can let go. And same idea. We're going to do one hand at a time now. And we're going to take the paper and place it between the ring finger and the pinky finger. You just grip it like that. And same thing. I'll pull it away and you hold on to it. Excellent. And let's do the other side as well. And then just hold on to that paper as I pull. Perfect. Excellent. Good job. Looks good. And now go ahead and turn your hands over. And what I'm going to do now is I'm going to be applying a bit of sensation to your hand. And I want you to tell me where I'm applying that, and we'll do both hands, and you'll tell me if it is the feeling is the same between the two hands. Okay? Good. So go ahead and close your eyes and just tell me where you feel the sensation. Okay, good. Good. And does that feel the same on both sides? Okay, great. Good. Yes. And for that, does it feel the same on both sides? Good. All right. Mm-hmm. Good. And does that feel the same on both sides? Okay. Mm-hmm. Excellent. And is that the same on both sides? Okay, you can open your eyes. This last thing, let me just take your pulses here. All right, you can relax. That completes the examination. Everything looks good. I've not found any issues, so hands are in good shape. Thank you, and we'll see you later.